in this next segment. It looks like Marty has discovered a magic wand. What is this thing?
I'm telling you, Tara, this is really, really fascinating news in the medical world. We're talking today, you know, we're hearing a lot about lasers. Well, a lot of the lasers that you see out there to get rid of lines on the face and whatnot, those are what's called hot lasers. We're talking about a cold laser that's actually getting worldwide attention in medical journals and all kinds of health publications. It's called the zirconium laser. And take a look at this. Can you see that red light on my arm? And this is called, again, the zirconium laser. It's a cold laser. And we've got the developer here with us, Stephen Shanks, and also Dr. Kevin Slattery. And Dr. Kevin Slattery is an internal medicine physician, and he participated in all the trials that were done with this laser. So it has been tried and tested and published, and a lot of people are giving it the thumbs up. It's used for different types of pain, like chronic pain, or to speed up healing before or after plastic surgery, wounds that won't heal, fibromyalgia. How does it work?
Basically, this is the first and only handheld laser that is FDA approved for chronic pain. What we're doing actually is finding on the body an area that is basically weak. We call those a myotome. We go back to the area of the spinal cord which has the nerve that innervates that one area. Using the laser, we can actually turn that nerve back on, re-stimulate, and basically the muscle will regain its full strength.
Well, we're going to show you how that works right now, and you guys know that I'm a big workout person, so as a result, you know, I have like little day-to-day aggravations on my body, little mini injuries, and you're going to take us through a little demonstration, and you've kind of determined that I have a weakness in my upper body, so let's show folks that.
So we're going to do a standard neurological test for C5 nerve root irritation, and as we put pressure, she starts to go weak.
Okay.
So what we're going to do is we're going to laser C5.
Where can you tell that I'm weak on my body?
Stanley Hoppenfeld wrote a book on nerve root irritations. So this would be C5, this would be C6.
So I'm basically weak where, though?
C5 on your neck. You have a nerve root irritation. We're going to have Dr. Slattery treat that, and then we should be able to turn that on in about 30 seconds.
And what Steve was just doing there was testing your muscle strength. And so you had a weakness bilaterally there,
on the side,
but worse on the left side. So what we're going to do is go right to the C5 area here.
Now, you're not penetrating the skin or anything, so I don't get how the light can really do anything.
It's photonic energy. Light is basically energy is bundled in a little packet of, they call photons. That light energy is in a continuous wave, and it basically goes through, it actually will penetrate through the body. When we treat, for instance, wounds and things like that, we can use a laser to actually penetrate right through the bandages. We don't even have to unwrap it.
And now what is that light is basically activating?
Activating the nerves right there at C5 level. And now what we'll do is that we will retest you, and then we'll see if you've regained your muscle strength. That's right.
All right. Here we go.
And now I'm pushing about 3 times as hard.
I cannot believe that. That is amazing. I mean, when he pushed on me the first time, I was really struggling, and I did feel like little twinges of pain in my shoulders. And when you push again, and you're pushing really hard, I don't have any pain. I just can't believe that. We actually did an earlier test on my knees because I've got a knee injury, and it worked on my knees, so that's why we wanted to do the upper body one, because that was the first time we did that one. If I can show you some pictures really quickly, because we mentioned this is used for wound healing. Now, this is a woman, doctor, who had a bad facelift.
She had what's called a reverse facelift, and actually the tissue did not respond very well, and so you can see that she has necrotic tissue there, the nasolabial fold.
After how many treatments?
3 minutes a day, 5 days a week for 6 weeks. This is the before and this is after.
And also, just to show you kind of on the inside what happens, they're also using this laser or this laser. This laser in use for liposuction, and what they're doing is they're liquefying the fat cells before they're sucked out. This is a regular fat cell that's just in the body, and this is after treatment with the laser. You can see it kind of starts to break up, and here it kind of starts to melt almost.
Liquefy. That's right.
Liquefy, and then it's sucked out.
It's taken right out.
And as we mentioned, the zirconium laser has been published in a number of medical journals, and it's going to be published in future medical journals as well. They've got the pictures to prove it, and I'll tell you what, from my standpoint, you know, Tara, it's not often that I'll do something and really notice an immediate reaction, because I will tell folks honestly how it affects me, and I was blown away.
I've never seen you so giddy.
Voodoo medicine.
Well, I mean, you know how working out in Mac's class, you kind of all aches and pains and this and that, and to all of a sudden have it go away like that, I was pretty amazed.